Well, thank you everyone for being here. I'm Mike Thompson, and I'm in the heart of our congressional district right now, and pleased to be here. However, not pleased as to why we're here. We're here today to talk out in regard to the incredible cuts that are focused on health care, and not only in our community, but across the country. And these are cuts that will be devastating to health care. It'll be devastating to the individuals who depend upon health care. And there's no differentiation between which healthcare patients are going to be impacted. The big focus has been on the bill that the House passed that requires a cut of $880 billion to the Medicaid budget. Now, a lot of folks think, well, that's just Medicaid, but that's just not true. It is, in fact, the Medicaid budget, but it's important to note that in California, 1 in every 3 patients is a Medicaid patient. So if you take a third of the funding out of any healthcare budget, not only does it impact people who depend upon that specific funding, but it impacts the delivery system of healthcare. So if you have a pocket full of gold and you can buy your own healthcare, or if you have the best private insurance policy available, if hospitals and clinics are having to reduce their overhead to make up for the $880 billion cut, the services available will not be adequate in order to take care of the people in that area. For those of us who live in rural areas, it's going to be real hard, because the rural hospitals, the rural clinics, rural health care is going to take a disproportionate hit, which means in order to get health care, you've got to drive further. It's going to hamper the preventive health care, which means people will not go to a hospital, to a clinic, or to get health care unless they're in an acute situation. It's harder to treat. It is more expensive to treat acute health care issues, so it just adds to the cost. There are a lot of other things that Medicaid provides funding for as well that will harm us all. There are a number of, ancillary services is the best way to provide that. We'll have someone talk about that today. But if you're in an addiction or a domestic violence program that not only provides you with the counseling and the help that you need, keeps your families safe, keeps you safe, but it also keeps you out of the criminal justice system. And if that goes away, that's going to increase cost in the criminal justice space, and it's not the best way to treat problems. There's some folks who are the benefactor of medical equipment, wheelchairs that allow them to live in their own homes. If they didn't have those, they'd be institutionalized, which would cost us more money as well. We could talk all day about how bad the idea of cutting $880 billion from Medicaid is, but we only have so much time, and we've got so many fantastic speakers. I want you to hear from all of them, and we'll just go in order. First, I'm going to introduce Sarah Gavin from Communicare Ole.
Thank you, Congressman.
You're welcome.
Good morning, everyone. My name is Sarah Gavin. I'm the Chief Behavioral Health and Community Health Officer at Communicare Ole, and I'm here to share directly what these cuts would do to our patients and our services and our communities. At Communicare Ole, we offer comprehensive health services. What that means is we provide medical care, we provide dental care, we provide behavioral health care, and substance use treatment at 13 health center sites across 3 counties, Napa, Solano, and Yolo counties, and we have been providing care in our communities since 1972. We are what's called a federally qualified health center, and what that means is that we are the essential community health safety net for the entire community, and we don't turn anyone away based on their inability to pay, regardless of their insurance status. At our health centers, we are serving 70,000 patients and clients across 3 counties, and 75% of those individuals rely on Medicaid, and another 5% rely on Medicare. So cuts like this would impact 80% of the patients and clients we serve. That's 8 out of 10 people that walk through our doors. The cuts would be absolutely devastating. Services that would be denied would be services for chronic health conditions, acute care, mental health care, substance use treatment. We are the primary outpatient provider for substance use treatment in Yolo County for individuals who are on Medicaid. The cuts would be devastating and directly impact the 56,000 individuals who are living in Congressman Thompson's area. And the individuals we serve are not just patients and clients of ours. They are family members, they are community members, they are colleagues, they are friends. They're also parents and children. They are people that are working, supporting local businesses, supporting industries in diverse industries like childcare, construction, agriculture, healthcare, and they are contributing and supporting our local economy. 70% of the revenue we receive at CommuniCare Olay comes from direct patient care. So cuts like this would be catastrophic to our ability to even operate. And in our communities, there is just not a lot of healthcare facilities that are serving individuals on Medicaid. And so our patients and clients have very few options if we close our door. The options are they don't get care at all, or they get severely delayed care, which means that critical diagnosis like cancer, get delayed and the care is delayed. It also means that they don't get access to substance use care and mental health care. And those who end up needing to seek treatment will end up using their healthcare provider as the emergency room or the hospital system, which are very expensive, overburdened models, and they're going to drive up care and costs across the region. And there are ripple effects to these cuts. So when there's cuts to healthcare, it also impacts people's ability to work. It is very difficult to work when you are not well. And when you're not able to work, you're not able to support your family, you're not able to support yourself, you rely more on social services, on nonprofits, lots of consequences that happen that was mentioned before, all of which negatively impacts communities. Access to healthcare is essential to the well-being of our communities. Healthcare is an absolute right, not a privilege, and Medicaid for the patients we serve is the critical support needed to exercise that right and receive the care that they need and that they absolutely deserve. Thank you for your time. I'm going to introduce next the Interim Vice Chancellor, Dr. Bruce Lee Hall from UC Davis.
Thank you, Sarah, and thank you, Congressman Thompson, for giving us a chance to be here and join this effort today. My name is Bruce Hall. I'm here as Vice Chancellor of UC Davis Health System. I'm a surgeon by training. We believe that our health system in UC Davis Health is a foundational piece of all of our communities, the communities we share with you and the communities that we serve together across all of Northern California and this region. We serve 33 counties as a catchment area, which covers 65,000 square miles and involves more than 6 million people. Patients are the center of everything that we do. As I mentioned, I myself am a physician and surgeon and have dedicated my life to taking care of patients and families. And I'm here today on behalf of nearly 20,000 of our employees in our health system who are similarly dedicated to taking care of patients and families across this region. We are the only level 1 trauma center, that's the highest capability trauma center serving our region. That's for both adults and children, pediatrics. We are the only burn center in this entire Northern California region and the only NCI, National Cancer Institute designated cancer care center. Our patients in Medi-Cal and all of our patients rely on us to bring these advanced capabilities to bear on behalf of their family members, their loved ones every day. As the Congressman beautifully stated already, this is not a question of taking one piece, a Medi-Cal piece, away and continuing with everything that's left. It doesn't work that way. For us, taking away a third of all the resources that we can apply means the rest of the health system starts to crumble. With cuts like this to Medicaid, it would put everything that we do at risk. Patients will stop showing up for their appointments because they can no longer afford them. Some patients may discontinue medicines or care plans because they can no longer afford to check in with their clinicians, their physicians, their nurse practitioners, their other advanced clinicians, everyone on the team. That means, as you've already heard, that means people will not show up until the situation is intolerable. And that's never the right time to keep someone healthy or to take care of any particular problem. There are also financial implications, and not just financial implications for the hospital, the health system. There are financial implications for patients and families. Medical debt will rise. Medical debt is a huge issue in our country and one of the most common causes of debt. So while we as health system leaders and as community leaders care a lot about financial resources at a very high level, please remember that down at the patient and family level, it is a major issue as well. Uncompensated care costs will rise, and we care a lot about that, but we really care about whether we're getting in front of keeping people healthy to begin with. Looking ahead, we in UC Davis and in the UC Davis health system will always stand for a sustainable approach to funding the resources that our communities need us to provide. We stand for taking care of all. We stand for patient care for all. We at UC Davis Health System are more dependent on government funding and government resources than many hospitals or health systems. And so this is an existential issue for us that we couldn't care more about. Thank you very much for allowing us a few minutes to speak today. And now I will invite my colleague, Sheila Allen.
Thank you very much. I am Supervisor Sheila Allen for Yolo County. Welcome to Yolo County, to the Congressman, and to the Helen Thompson Health and Human Services building. This is also where both Lucas Frericks and myself have our offices. Importantly, inside here is where much of what we're talking about happens from the county perspective. We have a service center where people come to get the programs and services they need in order to have a healthy life and in order to be productive citizens. So I wanted to tell you a little bit about some of the data for Yolo County. 15% of the people in Yolo County live in poverty. And importantly to what we're talking about today, about a quarter of the people in Yolo County are on Medi-Cal. So this will have a tremendous impact. And interestingly, if we are thinking about not just today, but tomorrow, 40% of the children who are born in Yolo County are on Medi-Cal. And for people who are hearing this who don't live in California, Medi-Cal is Medicaid in California. So it's important to know that when we're talking about Medicaid cuts, people here might not realize that means Medi-Cal. Medi-Cal not only pays for the primary and hospital care, but it covers many other programs in the community that the county works with. So I'm really pleased to have some of our partners in the community, because what the county does is our job is the safety net. And if you think about a net, there's all the different strands that need to be there. The nonprofits such as YOLO Healthy Aging Alliance, the YOLO Children's Alliance, NAMI, Rise Inc., all of them together help to make the net. Also included in it are the Medi-Cal funded programs such as YOLO Adult Day Health Center. So that is where people stay out of a nursing home. They're able to stay in the community. And if those cuts made, now they are no longer going to be able to be in their home, and they're going to have to go into a nursing home. And by the way, who pays for nursing homes? Primarily Medicaid pays for because people think Medicare pays for it. It does not. Medicare does not pay for nursing care. So from the county perspective, all counties across the United States are tasked with this safety net and with what has been called indigent care. Back years ago, the indigent care need in the community was quite large. Over the years, we've done some really important and great work by expanding Medi-Cal and also having ACA so that more and more people are covered by health care, so that the actual numbers of indigent persons who do not have the funding for their health care has very much shrunk. These proposals will vastly increase that. And I'm here to tell you, sadly, the county does not have the money to step in and suddenly pay for all these additional people. And the care that is needed in the community is always there. And if the funding goes away, the care that's needed is still there. And so you've already heard about and I'm sure that all of you know that the importance of early care and prevention. I'm a nurse, I'm a public health nurse, and prevention, $1 of prevention, back when I was in graduate school, it was $7. I believe it's more than that, but it saves that much more. So waiting until you are more sick or not getting the preventative care will be much more expensive if you only care about dollars. But if you also care about people, it will be much worse for the people. So from the county perspective, and as a nurse, this chaos and uncertainty that's happening, not from you, I'm happy to say, but other leadership federally, we must stand up and say that this cannot be. These are very important programs. These are caring for our most vulnerable in the community, and it will affect everybody. Thank you. Now we will hear from my friend Kate Laddish, who is going to give a constituent Medicare and Medi-Cal story, I imagine. Kate.
Ladybug on my computer. That seems auspicious.
That's good luck, yeah.
So thank you to Supervisor Allen for those remarks, and many thanks to Congressman Thompson for your dedicated leadership on this issue. I really appreciate it. I am alive today because of care I've received through Medicare and Medicaid, and I'm terrified about what cuts being contemplated, in fact being carried out, how that will affect people like me who depend on these programs for medical care and access to other essential services. Treatment covered by Medicaid and Medicare most recently saved my life when part of my digestive system shut down. I spent 2.5 weeks in a series of hospitals and ultimately had life-saving surgery. Without treatment, my intestine would have turned gangrenous and have burst, or resulting in excruciating death. This is a recurrent problem that's required 3 extensive hospital stays, including in the ICU, and numerous trips to the ER. Taking away my care by cutting Medicaid or Medicare would consign me to a horrific, drawn-out, and needless death the next time this happens. That's cruel and unconscionable. So I'm not just terrified, I'm also angry that these cuts are being contemplated. I have several rare musculoskeletal and neurologic conditions. Some are chronic, some have acute flare-ups, some are progressive. Since having to leave my beloved career in 2009 and go on Social Security disability, I've gotten the care that I've gotten through Medicare and Medicaid has been extraordinary. Treatment like physical therapy and occupational therapy help me manage significant pain and also helps me hang on to the function that I have and regain it when I have episodic losses of it. Treatment by Uber specialists in my conditions has improved my quality of life and decreased the frequency with which I experience the major and even life-threatening flare-ups. And you'll notice that I do refer to Medicaid and Medicare. The 2 programs together are vital for keeping this boat afloat. Medi-Cal, which as Supervisor Allen spelled out, is California's version of Medicaid. And it covers a lot of things that Medicare does not. And the biggest example is, as the Congressman alluded to, this wheelchair. So I experience episodic paraplegia and quadriplegia due to one of my neurologic conditions and frequent significant injuries due to another condition. Without this wheelchair, there are times when I wouldn't be able to get around inside my apartment or certainly wouldn't be able to leave it. I live on a little over $1,000 a month with Social Security disability and SSI. This chair would cost about twice of what I receive in a year. And so there's absolutely no way that I would be able to buy it myself. Medicare covers exactly none of it. This is entirely Medicaid through Medi-Cal. So Medicaid, as Medi-Cal, pays for other services as well. And one that's near and dear to my heart is in-home supportive services. I'm the chair of the Yolo County IHSS Advisory Committee and vice president of the statewide, the California IHSS Consumer Alliance. The goal of in-home supportive services is to help people with disabilities remain safely in their own homes. And the program does this by helping people with personal care tasks as well as some other tasks around the home. And you know, it makes it so you can stay in your own home rather than going into institutional care. This is tremendous. And IHSS benefits the people who are receiving the care. It also benefits the people who are providing the care in terms of its income. And in lots of families, the care provider and the care consumer are in the same family unit, and which becomes really important piece of the equation as we go forward. So IHSS is the most cost-effective way to keep people with disabilities like me in a safe environment at home. And defunding or cutting the program, which is what would happen with cutting Medicaid, will end up being more costly because people will end up in somewhere more expensive, like an institution or on the streets. And so this would affect the care consumers and the providers, and with people losing income, people losing the ability to stay safely at home, and in some cases this might result in whole families losing their housing and losing the coverage that they have through the care provider. So if Medicaid goes away, so does IHSS. So not only does that result in the people going into the institutions, the trick is that, as Supervisor Allen mentioned, who pays for that care? Medicaid. And so where do you go? There would be no safe place to live. What a bleak prospect that would be. So when the current administrative regime and some members of Congress, thankfully though not ours, talk about taking steps to and actually do cuts to Medicaid as well as Medicare, Social Security, and other essential programs, what it says to me is that they don't care if Americans like me die, which is not an easy thing to say. But that's the bottom line, is that these cuts will result in needless suffering and needless deaths. And that bleak prospect, though, is not something that needs to come to pass. I think it's really important that everybody continue to speak out, and that there continue to be events like this to help get the word out, and so that we can all continue to work together to stress the importance, the actual life-saving importance of these programs, and do what we can to save them going forward and try to correct the course that the federal ship is on. Thank you so much for this opportunity. Thank you, Congressman Thompson, for your leadership. And it is truly my honor to introduce Susana Hernandez of SEIU Local 2015.
Hi, good morning, everybody. My name is Susana Hernandez, and my speech I do in Spanish because they affect to everybody, no matter what, any language, any race, to everybody. So, my speech is in Spanish. So, buenos días. Mi nombre es Susana Hernández Gómez y he trabajado como cocinera durante 17 años en los centros de cuidado para personas mayores, tanto en Davis como en la ciudad de Auburn. También soy un miembro orgulloso de mi sindicato SEIU 2015. Que protege a los trabajadores tanto en el hogar como en cuidado de asilos de ancianos. Como todos sabemos, Medi-Cal está en peligro, que significa que más de 80 millones de estadounidenses, incluyendo personas mayores de Estados Unidos, niñas y niños, personas con discapacidades, dependen de este programa. también está en peligro. En California, Medicaid, llamado Medicaid también, programa que dependen 13 millones de californianos, incluyendo 60% de personas en cuidados de centros de convalecientes. Para todas esas personas tenemos una preocupación, porque ¿qué sería de nuestros pacientes? ¿Qué sería de nuestros residentes? También nosotros como empleados, ¿qué sería como nosotros? Perderíamos nuestros trabajos. ¿Cómo podríamos sobrevivir en este mundo? En mi centro de convalecencia, por falta de personal también tenemos que si perdemos Medicare o Medicaid, no tendríamos personal para trabajar. Nuestros residentes nos necesitan, porque ¿quién cuidaría de ellos? ¿Quién los ayudaría? Con respecto a las personas que nos ayudan, que son las CNAs, no son suficientes para los residentes, porque muchas de las veces no tenemos el personal y nuestros residentes pueden sufrir accidentes, tanto el residente como nuestros empleados también. En el área de la cocina también estamos veces cortos de personal. No tenemos el suficiente. En una ocasión, la comida ha retrasado por 1 hora y media. Y esos residentes, los pacientes, necesitan sus alimentos porque padecen de enfermedades y puede ser causas severas para ellos. Tengo una historia muy personal. Es mi hija. Yo tengo una hija. Cuando ella nació, fue diagnosticada con 4 hoyos en su corazón. Fue muy difícil para mí. Después de eso, se le diagnosticó hipotiroidismo, asma, triple X, una condición que nadie nombra. Pero gracias al programa de Medical, ella puede tener sus atenciones y seguir con su ritmo de vida. Porque si no fuera por Medical, yo no sé qué sería de mi hija. Por eso es muy importante que para todos nosotros pidamos a nuestros representantes que apoyen nuestro programa por nuestras familias, por nuestros trabajos y que no nos dejen caer. Porque yo sé que unidos todo lo podemos lograr. Nada es imposible. Y yo sé quién está tomando esas decisiones. Se va a tocar su corazón y pensar en todos nosotros que tenemos una necesidad. Muchísimas gracias a todos y de todo corazón pidamos a nuestros representantes que nos apoyen y que sigamos en la lucha día con día para salvar vidas y tener trabajos y cuidar de nuestras familias. Muchísimas gracias. Ahora lo dirá mi intérprete, porque también ellos quedarían afectados. Muchas gracias.
Interpreter for Susana Hernandez. Good morning, my name is Susana Hernandez and I have been a cook in nursing homes for 18 years. I am also a proud member of my union SEIU 2015, the nation's largest long-term care union representing more than 500,000 home care and nursing home workers. As we all know, Medicaid is in danger. That means that more than 80 million Americans, including seniors, children, and people with disabilities who rely on this program, are also in danger. In California, Medicaid is called Medical, a program that more than 13 million Californians rely on, including 60% of nursing home residents. Cutting Medical will wreck the nursing home industry, an industry already struggling due to the chronic understaffing situation, high worker turnover, and a skyrocketing demand for long-term care. In my facility, this understaffing crisis has jeopardized the safety of our staff and residents. Recently, we were so understaffed in the kitchen that our resident lunch was delayed by 1.5 hours. In a nursing home, where many residents have strict dietary needs or other medical conditions, an hour and a half delay can lead to severe health complications. My department isn't the only department that's understaffed. Sometimes we have only one CNA to take care of 25 residents during the day. The problem can be even worse at night when one CNA is taking care of the 40 residents. When CNAs are understaffed and carrying a high workload, my co-workers and our residents risk injury. I have seen a resident fall and get injured because of lack of staff. And when my co-worker went to help the resident, she got injured too because there was no one there to help her safely lift our resident. Cutting medical will only worsen the understaffing crisis in nursing homes, like the one I work in, leading to even more injuries for my co-workers and our residents. And the worst case scenario, which we are approaching if Congress doesn't take action to protect medical, nursing home residents will lose access to critical long-term care and could end up homeless. And because medical cuts could lead to nursing home workers like me losing our jobs, will be at risk of becoming homeless too. For many, medical has made the difference between life and death. In my life, it's been personal. When my daughter was born, she had 4 small holes in her heart, a thyroid condition, asthma, and an extra chromosome. Medical is the only reason she was able to receive the vital care she needed as an infant. Now she is 17 years old, and we rely on medical to afford the medications and treatments she needs to stay healthy. The lives of 80 million Americans must take priority over tax cuts for billionaires who already have far too much wealth and power. On behalf of nursing home workers across California, I urge every member of the Congress to stand up for the people you were elected to serve by saying no to Medicaid cuts. Thank you.
Well, thank you all very, very much for your beautiful statements. And it's real clear to hear these great witnesses that this is more than just numbers on a budget page. What's happening right now is a value statement. This is about the value of the American people, the value of our communities and our society. This is a misplaced cut, as are many of the cuts that we're looking at right now, many of the actions, much of all of the chaos that's coming out of this administration. And it's certainly heartening to hear the professionals in the community speaking up as to how this will in fact hurt our community. So thank you all very much. Sheila, thank you for calling out the Helen Thompson naming on this building. Helen, as most of you know, is an incredible community member, served on the Board of Supervisors, served in the state legislature, in the assembly. And if she were here today, I would tell her that they left the P out of her name. She would tell you that I don't know how to spell my name. But,
She's just a couple blocks away. She's still alive.
And she's just done so much for our community. Such a wonderful community member, friend, a nurse, married to a doctor. Her husband served the community in the healthcare space for many, many years. So it's appropriate that we're here, and thanks for pointing that out. Anyone have any questions? Thank you all. Thank you.
Thank you. Can we take a picture with all of us?
Oh, yeah.
And then